How concerned should you be about monkeypox? Joining us now to discuss is Dr. Yalda Safai. Doctor, let me ask you, generally speaking, and I'll get to some more specifics, should people be concerned? I mean, it's getting more headlines. We have all seen medical conditions be politicized over the past couple of years. What's going on here, you think?
I think it's really important for people to understand that we're not dealing with the same virus like COVID. Monkeypox is not easily transmissible. You need real close contact with somebody, skin-to-skin contact, secretions that come from close contact, or bodily fluids in order to be able to get it. So it's not easily transmissible. Now, I think what people don't realize is when you declare a public health emergency, it is not meant to stir mass hysteria. A public health emergency allows you to allocate funding, resources, vaccines, testings to the problem. We are now 7,000 cases in. Yes, we're seeing it more in communities where men have sex with men, but it doesn't mean it's just going to stay in those communities. It can spread in any community because, like I said, it's spread by close skin-to-skin contact and secretions and bodily fluids and also fomites, which means a contaminated person touches a bedding or a towel. If you touch that bedding or a towel, you can possibly get it too. So should we be on alert? Sure. Should we create a mass hysteria? No, because it's not as transmissible as COVID was.
And not as deadly either, we might mention. Now, having said that, I'm looking at reports out of Africa that say most of the cases there are not concentrated amongst gay men. It's going to, now, I don't know which comes first, the gay community, and then it expands beyond that, or vice versa. Maybe it came here in a different way. But this is from the WHO. I'm going to leave the politics out of the WHO. But how should we expect this to unfold in the coming weeks?
As in, will it spread to communities outside?
Yes, yeah. I guess that's my question. I mean, obviously in the gay community, that's where it is now, primarily here in the United States. But do you think this goes beyond that? It says, as you're saying, it's possible. So do you think that will happen?
Of course, this is not a sexually transmitted infection. Like I said, if you come very with somebody who has the virus, you can possibly get it. So it's not going to just be contained in the gay community. It will spread. So at this point, we need to take proper precautions to prevent that from happening because we're 7,000.
So what do you think when you see somebody like Governor DeSantis not declaring a state of emergency over monkeypox? You still think he has the resources to deal with it?
I mean, it depends. Right now, the states leading in cases are New York, California, and Illinois, which makes sense, right? You have two coastal states and one state that houses one of the busiest airports internationally in the country. So you see thousands of people coming in and out internationally, possibly bringing the virus into their state. So you have to look at the cases in your state and make an informed decision based on that. This is not something that, yes, we need to declare it an emergency on a national level before states take it into their hands to declare an emergency. But also look at the demographics, look at the cases in your state before deciding that.
Do you know how badly the scars are in after somebody has this? Because it's one thing, I mean, nobody wants to die. That was the whole thing about COVID. It could be very deadly depending on the situation. This doesn't look to be deadly, but the pictures are horrible. And then you hear there's reports that it's excruciating and that it can leave some scars.
I mean, chickenpox is the same, right? It could leave scars. It's very uncomfortable when you have the illness. It's pretty much the same. When you do have it, as long as you're not picking at it, not scratching at it, you're decreasing your chances of getting a scar. But is it possible that it will leave scars? Sure, just like chickenpox.
All right. Doctor, thank you so much for being with us.
Thank you.